Thank you very much, Mick. And AHPA and IAHA members and invited guests, Commissioner Mick Gooder, MC and Aboriginal and Torres Strait Islander Social Justice Commissioner, Lynn Littlefield, Chairperson Allied Health Professions Australia, Faye McMillan, Chairperson Indigenous Allied Health Australia, and my parliamentary colleagues. I acknowledge the traditional custodians of the land we are meeting on, the Ngunnawal people, and pay respect to their elders, past and present. Good afternoon, and can I say what an absolute pleasure it is to be here with you this afternoon. I would like to start by commending Allied Health Professions Australia and Indigenous Allied Health Australia for their work to support Australia's allied health professionals and for their ongoing commitment to the health and wellbeing of all Australians. Ladies and gentlemen, I am honoured to be here with you today on Close the Gap Day to recognise this very significant event. On Close the Gap Day, we recognise the efforts of Indigenous and non-Indigenous health practitioners, governments and other bodies, including those here today, committed to closing the gap in Indigenous disadvantage by 2030. Since its inception in 2006, Close the Gap Day has grown in significance. In 2014, it is estimated there will be more than 1,200 Close the Gap events involving around 150,000 Australians. Change is happening. We are starting to see improvements, but there is much more to do to raise the health and life expectancy of Indigenous people. As a nation, we must work together to achieve our goals, and it is in this spirit of collaboration and partnership that we meet here today. Partnerships are fundamental to ensuring that improvements are sustained and that Indigenous people enjoy the same level of services and health outcomes as most other Australians. In his recent Close the Gap statement, the Prime Minister placed emphasis on partnerships to improve school attendance and education, employment opportunities and community safety, so together we can make a meaningful difference to the lives of Indigenous people. Good health is an essential ingredient in achieving our aims. It seems obvious, but ear health, being able to hear, and eye health, being able to see, profoundly affects young school children's ability to learn and participate in class. And even starting each day with a healthy breakfast is so important to having our children ready to engage and excel in school. And having recently visited communities in Northern Territory, Western Australia and Queensland, it reinforced to me how important this is. The message is simple. Good health leads to better and longer lives, and with that comes the positive flow-on effects to families and communities. The statement of intent between IAHA and AHPA is another important step in the campaign to close the gap, a step that will contribute to improvements in health outcomes for Indigenous people over coming decades. This commitment will see some 22 national allied health organisations coming together to work on innovative ways to close the gap, and we welcome their involvement in this important cause. And it is very important that we increase the spotlight on allied health. The Australian Government values the role of allied health professionals in Australia's healthcare and service delivery alongside doctors and nurses. It is estimated that of the 120,000 allied health professionals in this country, less than 2% are Indigenous Australians. Allied health professionals work across health, education, justice and community sectors and are in a unique position to affect the complex determinants that influence Indigenous health and wellbeing. The partnership signed today will put steps in place that will help strengthen the capacity of allied health workers to respond to the needs of Indigenous people, their families and their communities, a fundamental element to close the gap in Indigenous disadvantage. Moreover, and in keeping with the Prime Minister's Closing the Gap commitment, this partnership seeks to encourage more Indigenous people to enter the allied health workforce through leadership and mentoring opportunities, to the betterment of education and long-term employment. I would like to thank Indigenous Allied Health Australia, Allied Health Professions Australia, its member organisations and affiliates for inviting me here to be part of today's signing ceremony. Thank you.